Our next speaker is Joe Massaro. He'll be speaking to us about designing and operating a high-performing DMC/DSMB. A little background on Joe. He's a professor in the Department of Biostatistics at Boston University School of Public Health, focusing on teaching statistical methods for clinical trials. He has over 30 years experience in the design and analysis of clinical trials, DMCs, and adaptive designs. Prior to joining BU, he was the Assistant Director of Data Management and Biostats at Quintiles and is currently a statistical consultant at Boston Biomedical Associates and a general statistical consultant to the pharmaceutical and biotech industry. With that, I'll hand it over to Joe.
Thank you. Hi, thank you very much for coming, and thanks very much to SDC for asking me to speak here. I guess I need my slides up. Well, thank you. Okay, so what I want to talk about is data monitoring committees and kind of the interaction with them and how to, designing and operating them. Outline the brief role of the DMC. We'll discuss that. Then I'll talk a little about the FDA guidance on DMCs and DMC Charter, and especially focusing on the confidentiality of results of the interim analysis. And related to that, the final topic will be on how the DMC can communicate with the sponsor so as not to divulge results that may be confidential, because it does lead to operational bias. Okay, so here's the setting. This would be a randomized, controlled clinical trial. It could be double-blind, single-label, open-label, but it is a randomized design. And we'll talk about the situation where the DMC inspects unblinded interim looks of the data, so separated by treatment group. And this is at the interim, so it's prior to all patients being treated and followed. And the DMC will make recommendations based on this interim look about future trial conduct. And examples of some decisions could be simply continue the trial as planned based on the interim analysis. But there could be safety concerns. For example, stop the trial early if there seems to be evidence of harm, especially of the new investigational product. From an efficacy perspective, in terms of interim looks at the data, the adaptive design, these are just examples of a few recommendations that can be made. Stop the trial for futility of the experimental treatment. Based on the interim data, there's really no difference between the treatments. It doesn't look like there's going to be any difference between the treatments by the time the study's over, so it might be worthwhile just to stop for futility to save time, not waste patients' time, and save money. Or something more positive, stop for overwhelming efficacy of the experimental product. The experimental product is working a lot better than we thought it would based on this interim looks, so let's perhaps stop and start the approval process. Others are increase the sample size re-estimation based on the interim looks. Things are looking good, maybe not as good as what you thought when the study before the study started, but still promising, but we need a larger sample to maintain adequate power. So those are just examples of a few decisions that the DMC will make based on their review of the interim unblinded data in a protocol that allows for such interim looks. Okay, but it's important that the sponsor be kept, and really anyone involved in the study conduct, be kept unaware of those results as much as possible. These are a few quotes from the FDA guidance on DMCs, on data monitoring committees, from the section titled Confidentiality of Interim Data and Analyses. And basically they say that, look, if a sponsor knows the interim data, well, first of all, it's not necessary for the sponsor to know the interim data. And in the middle bullet point, it's because it can bias the outcome of the study. If the sponsor is made aware of unblinded results, then who knows how it's going to affect the remaining conduct of the study. Okay? And the bottom bullet point there says, you know, if the sponsor is aware of the results, it may become impossible to make changes in the trial in an unbiased manner. So it's very important to keep the sponsor unaware of the results as much as possible of the interim analysis. But we'll see that sometimes that's a little easier said than done. Because the DMC does have to communicate to the sponsor or the steering committee following their review of interim data. And just what should they say and how do they say it? Well, in the guidance it says the communication should be as terse as possible, okay? You know, study can continue as is. And that's it. I mean, you can say, hi, how you doing? You know, like, but study can continue as is. But then if the study, if that's not the recommendation, then it has to be more detail maybe needs to be given. For example, the DMC recommends increasing the sample size by 50 per group. But even then, there really should be no discussion of to why. It's like, what did the results look like that led to that decision? The DMC, the sponsor needs to either go with the recommendation or not, so that they don't, without looking for more information, which is not an easy thing to do. Okay? But there is a point where if the DMC recommends stopping the trial, if they say to the sponsor, we've looked at the interim data, we recommend stopping the trial, either because of futility or excellent results or safety. Well, at that point, it's unfair to ask the sponsor to stop the trial without themselves maybe taking a look at the data. Okay, it's difficult for a sponsor to follow a DMC recommendation in that setting. Okay, and I'll give you one example. I'll give you actually a couple of examples of the DMC, kind of where there's had to be difficult DMC communication with the sponsor. Here's an example from a safety perspective. This was on an oncology trial I was a DMC member on a few years ago. There was a certain type of cancer, and it was, you know, best medical care or placebo was the control versus the experimental. And after 40 patients were enrolled, 20 in each group, and treated for several weeks, the DMC inspected unblinded safety data. And it turned out the experimental treatment had 4 life-threatening serious adverse events, and the placebo group had none. Not only that, the 4 life-threatening events were all related to liver function. So it looked like something was going on here. Now, as the statistician, I was asked to calculate a p-value, and it turned out there actually wasn't a significant difference between groups. But at the same time, when you're talking about safety, statistics isn't as important. So the DMC did make a recommendation to terminate the study based on these 4 life-threatening liver SAEs that occurred in the experimental treatment and none in the placebo. But you know, it took about 3 or 4 hours to come to that decision. There was a lot of discussion back and forth. Okay. But the sponsor got back, so the DSMB had their meeting, and the sponsor got back on the phone, and the DSMB made their recommendation, and they had to explain why. Okay, their recommendation was to stop the study for safety, and they had to explain why. Now, it's a recommendation by default. The DMC does not have the wherewithal to stop the trial. They just make recommendations. If the sponsor did not follow the recommendation, now you have a potential issue, because now the sponsor is made aware that there are 4 experimental treatment group liver function adverse events? And will this awareness affect the subsequent study conduct, even unintentionally, okay, causing bias in the remaining safety data? I mean, what if when the trial was done, those were the only 4 liver-related serious adverse events? Would people start thinking, well, something's going on here? They changed their reporting. I mean, bias and the perception of bias are almost just as bad. So it turned out the sponsor did follow the recommendation, but that wasn't an easy, they didn't say that day, we're going to follow your recommendation. As soon they had to go back and think about it, but any repercussions about telling the sponsor the result, you know, especially given the FDA concern about confidentiality of data, had to be weighed. But the sponsor did decide to terminate at that stage. Okay. So again, for efficacy now, what information does the sponsor need to be made aware? If it's to increase the sample size, that's really all they should be made aware. Increase the sample size to X. And then again, the sponsor needs to decide whether they should follow this recommendation. Okay? They ideally need to do it without knowing the underlying reason the DMC made that recommendation. Is it fair to them to do that? Okay? And it might not be fair, but if they have any knowledge of the results that made the DSMB recommend increasing the sample size, there goes your potential confidentiality of results. There goes the FDA's concern in the guidance about sponsor knowing too much, affecting the remaining conduct of the data. I'll give you another example. Well, this example is related to efficacy. Okay, this was a rare disease, and it was very difficult to enroll. It was a randomized trial. The sponsor needed 80 experimental and 40 placebo, and the outcome was mortality. Okay. The DSMB recommended increasing the sample size to about 30. They did an interim efficacy analysis about halfway through, and they recommended increasing the sample size to about 30 subjects. And the sponsor couldn't do it because it was such a rare disease. It's going to take them, they said it's going to take us long enough to get the original 80 and 40. Okay? So the trial continued. And when it was done, I was the statistician on the project. I wasn't on the DMC, but I was the one who received the final data, and I generated the results. And when I got the final data set, the results was a significant beneficial treatment effect. And it's not often I get to spread good news like that, so I was very much looking forward to the conference call the next day with the sponsor to tell them that you had a significant beneficial treatment effect. And the response that the sponsor gave me was, how could this have happened? And they were quite upset. Now, as I sometimes have to ask my wife, did I do something wrong? Okay? I didn't know. Okay? I didn't know what to say. So I said, well, what is the problem? It turns out, after the DMC made their recommendation, the sponsor sent out a press release. And the press release said, I took a look at it afterwards, and it said, the DSMB recommended an increase of sample size of X to maintain 80% power. We cannot do that, okay? However, we are still considering the study supportive as part of our program, because they thought the DSMB recommendation that they couldn't follow meant their study was going to fail, okay? And that is the vibe you get from the press release. And they got mad because they had investors pull once that press release came out. And now, if investors find out the results were significant, would they sue? And, you know, so there's that concern, but there's also the concern of how will investigators involved in the study take this press release? Will they be less enthusiastic about participating in the study? How is that going to affect results? How does the sponsor itself affect the remainder of the study? Because they will probably seem less enthusiastic, okay? So I explained to the DSMB, I'm sorry, to the sponsor, the DSMB asked you to increase the sample size. You couldn't. That just means you didn't have 80% power for a successful result. But guess what? You still had 70% power for a successful result. So you still had a good chance of a successful result, and that chance came through under the trends that the DMC saw in the interim data. So you have a certain type of bias. The DMC did basically what they were supposed to do in terms of their communication, but the misinterpretation of the results by the sponsor, did that lead to a certain type of bias? Okay? So it's important that sponsors are made aware of what these recommendations really do mean. Okay? So again, did the sponsor's feeling of a failed trial affect the remaining data after the DMC made their recommendation and the sponsor couldn't follow it? Did investigators feel the same way? Should the sponsor have even sent out a press release following the DMC recommendation? Perhaps they should have, but you know, because people might be anticipating the DMC meeting, but what does it really need to say? You really got to sit down and think it through. And again, make sure that the sponsor is not misinterpreting results. Okay. Another quick example, I was involved in a trial on graft versus host disease, and these are the interim results. The outcome is treatment failure by day 80, and that's bad. And the placebo had a lot less treatment failure than the experimental. So much so, these were basically the exact opposite of what was anticipated in the protocol. Okay? So how does the DMC tell the sponsor this? Because the first thing the DMC thought of is, this is so bizarre that it's the exact opposite of what was anticipated in the protocol. Was there a mistake made somewhere in the randomization, for example? Did somebody mix up the randomization code? I was the one who ran the analysis, so I started breaking out in a sweat and saying, oh gosh, wasn't me, what did I do? But it turned out, you know, all kidding aside, I checked to make sure that when I saw the results that there wasn't an issue. So what do you tell the sponsor? So the DSMB called the sponsor after inspecting the results and did not say anything directly, but said, can you double check your randomization process? Can you double check the makeup of the treatment kits and things like that? So the sponsor is kind of aware something's wrong, but the DSMB did not tell them results. So the sponsor took a couple of weeks to check, and no mistakes seemed to be made in anything, especially in the randomization. And so at that point, the DSMC said, okay, this is what we're saying. You know, and so they had to be unblinded. The sponsor had to be unblinded. But at that stage, there was no way the study was going to be a success. Even if the sponsor continued, in all likelihood, in all likelihood, the sponsor would stop the study, which they ended up doing. But, you know, when you're giving a sponsor unblinded results as a DMC person, you just got to really make sure all the bells and whistles are in place. Okay. Just general issues. If the DMC says increase sample size to X, and we saw one misunderstanding, what does also happen is people feel, oh, we must be close. We just need to increase the sample size a little. We can do that. We must be close. We must be close to significance. Well, will that not process bias anything? Okay. One time I was involved in a study where the DMC said continue the study as is, and I had an investigator call me up and say, well, the product must not work because the DMC said continue the study as is. If the product worked, they would have stopped the study. And I had to explain, no, you have to really have overwhelming efficacy to stop the study. But even something simple as continue the study as is can cause bias. This is one of the FDA's biggest concern. Here in the U.S., they will often require, you know, the statistics is nice to work out the increase in type 1 error and all that. And, you know, there's a lot of methodologies available. One of the biggest things the regulatory agencies ask for is how will you minimize operational bias entering a study? We want a plan. And one big part of that plan is having an independent DMC, but outlining the communication process, etc. Okay, so just in conclusion, the DMCs make recommendations on study conduct issues while the trial is going. Confidentiality of results from the sponsor confidentiality of the results from a sponsor as much as possible is necessary to avoid bias entering the trial. DMC recommendations with the sponsor can have repercussions, need to be as terse as possible, and important to consider repercussions of communication and minimize bias. Thank you very much.
Anyone have any initial questions for Joe?
Based on your experience, post recommendation for modification to the protocol, is the FDA doing any empirical evaluations of the results based by stratifying the results to look at operational bias?
Like before and after?
Yeah.
Yes, I mean that's often requested in the study to make sure that the trend in the data before and after, that there's not a significant difference with respect to the treatment difference, if you will. Yeah.
So how do they, when that occurs, and it could occur by chance, just because the sample size is split, it could
very well be.
How do they resolve those types of situations?
I haven't been involved in a situation where it was an issue, thankfully. Okay. But you know, it could, if there's not a reasonable explanation, it could jeopardize the trial. Yeah.
Thank you, Joe.
Hi, Joe.
How you doing?
So I found your example of the sponsor's press release pretty interesting, because I think it's actually very relevant to small companies. I know that at a large company, the DMC increasing the sample size would not be a big event, and it would not be considered for a press release. But at a very small company, such as the one that I'm at, I have arguments with our lawyers about what's a material event, and our legal counsel tells me that they're obligated, being a publicly traded company, to report material events. And so that is a judgment call. And so there's a lot of education that I think the statisticians need to do to not only upper management, but investor relations and legal counsel about what something like this means for an interim analysis in the middle of a trial. And maybe that's something that the statistical field needs to consider.
Yeah, I 100% agree with everything you said. It is more, this was a relatively small company. This is their only product. Now, they had other trials ongoing on this product, but this was one of their phase 3s. And I also agree about you making sure, you know, a statistician or somebody make sure that the press release doesn't say too much. The sponsor never should have given an indication, well, we're going to consider this supportive. Like, they never should have given the vibe that doesn't mean it's successful. If anything, give the vibe this doesn't mean, you know, say something like this doesn't mean it's not going to be successful. It just means maybe, you know, I don't know how far to go. But yeah, I agree. It was the vibe in this case that the study was not going to be successful that caused the problems, I think.
Hi. Very interesting.
Thank you.
I see the potential benefit to both the patients and to the sponsors for having a data interim committee. Can you just tell me, as a sponsor, what would be the risks or benefit to do this? Because it's not mandatory to do it. But if you're a sponsor and you want to have the best possible outcome, would you recommend that this is a routine practice, or are there risks to sponsors other than what we just talked about?
I generally recommend it. I mean, and in fact, I'm on some trials I'm on where the protocol doesn't call for it. The FDA statistician will write back, consider doing an adaptive design. We actually get recommendations from the FDA. I think the biggest issue is this operational bias. If you can show that, you know, a plan beforehand that this will be minimized as much as possible. But a lot of sponsors I work with, when they come up with their sample size calculations, they're very unsure about the assumptions. And so for that reason, I generally, if they do, I generally recommend this. We just got to make sure this is all worked out as much as possible. Yeah.
Did you employ the zones, like the utility zones?
Exactly. I mean, so you lay out, you have to lay out in the protocol that if the conditional power, you know, is between 35 and 80%, you're going to increase the sample size. You know, and that's the other concern people have is this, what about this back calculating? You know, could somebody back calculate what the sample size recommendation was based on? And then if it's less than 38% or greater than 80, there's no change to the protocol. So if there's no change, it could mean basic failure or close to failure or tremendous success. They don't know. But they will, you know, they do have some idea that, some, you know, especially when it's increased the sample size to XXX.
All right.
Thank you very much.
Thank you, Joe.